Hi, my name is Dr. Tom Morales, and in this video, I'm going to talk about some of the things that you can do to take care of yourself at home if you have COVID. Before I begin, I wanted to talk about some of the alarming symptoms associated with COVID. If you have any of these symptoms, you should go to the hospital as soon as possible. That way you can get the necessary treatment and prevent any further COVID complications. So these symptoms include having a very high fever. I'm talking about a fever greater than 103 degrees Fahrenheit. Another warning sign or alarming sign is having a very low temperature. Other symptoms include shortness of breath, and I'm talking about if you have oxygen levels less than 94%, you should go to the hospital as soon as possible, because this could be a sign that you could be developing pneumonia or acute respiratory distress syndrome, which can result in death. Other symptoms include palpitations, shortness of breath, and confusion. If you have any discoloration, any blueness on your lips, this is also an alarming sign. If you have any of these symptoms, please go to the hospital as soon as possible. Another piece of advice I want to give you is don't self-medicate with any of those medications being promoted in social media. I'm talking about medications such as hydroxychloroquine. These medications have no proven benefit and can have toxic effects. All right, so tip number one is you gotta buy yourself a pulse oximeter. You can get these at Walmart for $15 or at Amazon for about $30. I'll leave the link below. Basically, this machine, this little device, helps read oxygen levels. And we all know that COVID is a respiratory virus. If you have an oxygen level less than 94%, you should go to the hospital as soon as possible, because these are signs that you can be developing pneumonia or acute respiratory distress syndrome, which could result in death. Once you go to the hospital, they'll take an x-ray, they'll do some blood work, and they'll measure your oxygen levels and give you oxygen if you need it. And the oxygen, they can give it to you via a nasal cannula, or they can give it to you via a mask, a CPAP, a BiPAP. And ultimately, if you need it, they will intubate you and start you on some antiviral and steroid medication. The best way to know when you need treatment is by monitoring your oxygen levels. All right, so tip number two is you need to go get yourself a thermometer. A thermometer is important because you want to monitor to see if you have a very high fever. So a fever is defined as any temperature above 100.4 degrees Fahrenheit. If you have a temperature greater than 103 degrees Fahrenheit, this is an alarming symptom. It's an indication that you have a high fever and that your infection is really bad. If you have a temperature less than 95 degrees Fahrenheit, then this is also an alarming symptom, because it's a sign that you have hypothermia, and it can also indicate that you have a very grave infection. So tip number three is Tylenol. Tylenol is good to relieve headaches and fevers associated with COVID, but some doctors are actually recommending against the anti-fever medication, because fever is a natural body response that helps fight off viruses. The theory is that if you elevate your body temperature, the temperature in your body will be so hot that the virus will not be able to tolerate it, and then ultimately the virus will kind of dissipate or die. But if you can't tolerate the fever or the headaches, you can take Tylenol. The recommended dose for adults is 1,000 milligrams every 6 to 8 hours. This is about 3 times a day. In terms of a dose for kids, you want to read the instructions on the back of the drug facts. And if you don't have Tylenol, you can also use ibuprofen. It's also a good alternative. I know at the beginning of this pandemic, there was a concern over ibuprofen's safety in the context of COVID, but recently there hasn't been any strong evidence against ibuprofen in the setting of COVID. All right, so tip number 4, you gotta drink fluids. And obviously the best fluid in the world is water. You need water to rehydrate yourself, but you can also buy some Gatorade and some Powerade, or you can get yourself some liquids with electrolytes such as coconut water. And basically this will help replenish the electrolytes and also keep you hydrated. That way your body is in a better position to fight off the infection. All right, so tip number 5, chicken soup. Yeah, we're talking about mama's tasty, delicious chicken soup. Chicken soup not only helps alleviate some of the congestive symptoms that you have, but it also was found to have some anti-inflammatory effects. There was an article published on Chest magazine in the year 2000, and some scientists, found that, perhaps this chicken soup has some anti-inflammatory effects on the body that can help fight off flu-like symptoms or the common cold. Tip number 6 is tea. So tea is not only delicious, especially if you add honey, but it also helps alleviate some of those congestive symptoms, and it soothes any painful throat that you have. And tip number 7 is you have to sleep well. Sleep is good for your immune system, and it's good for your overall health, and ultimately it will help you recover against this COVID infection. If you can't sleep well, you can always buy yourself some melatonin over the counter. Tip number 8 is you have to exercise, and I'm not talking about lifting weights or going on the treadmill and running for a long period of time. I'm talking about breathing exercises. You gotta take deep breaths. So these deep breaths, if you do that for a couple of times a day, it will help strengthen your respiratory system. Another exercise that you should do is cough. This helps clear out any mucus that you have in your respiratory system. And another exercise that you should do is you gotta walk. You gotta get out of bed. I know that when you're sick, the last thing you wanna do is get out of bed, but you need to walk because you wanna make sure that there's circulation flowing to your legs, and you also wanna make sure that your legs are strengthened and you're not weak once you're fully recovered from COVID. All right, so tip number 9 is that Vixx. Where's my Latinos at? Where's my Hispanic people at? Vape VapoRub, what we call it in Spanish, or Vixx. Basically, you need this to help you out with the congestive symptoms, and also it helps relieve some of that cough you might have. All right, so tip number 10 is mindfulness. Mindfulness includes prayer, it includes meditation, and mindfulness and prayer, meditation is important to reduce the amount of stress and anxiety that you have. Once you reduce that stress, it puts your body in a better position to recover. All right, so there you go. Those are my 10 recommendations on how to take care of yourself if you have COVID. Remember, if you have any alarming symptoms, please go to the hospital as soon as possible. If you enjoyed this video and if the information that I provided was of benefit to you, please like and subscribe to my channel, Dr. Tom Morales. God bless you.